Welcome, Pam.
Thank you, Jeff.
Right next to Pam is Dr. Aidan Abdullahi. He has two clinics, one at Landmark Plaza and also at Karen Hospital. Dr. Ari, welcome.
That's right. Thank you.
And of course, next to me, Mr. Style himself, Derek Banga, image consultant. He knows a thing or two about style. That's why I had to look pretty sharp today.
Good to see you, Jeff.
Good to see you, Derek. Welcome, all of you.
Thank you.
Before we go into discussion, take a look at that screen and these images. Roba, not Monica, right? It's Roba. Robert, let's take a look at the types of surgeries we have available. Okay, cosmetic surgeries. We have Botox, which is very popular, obviously. Facelift, breast augmentation, and breast lift. We also have, you can see that, okay, breast reduction, hip and buttocks enhancement, tummy tuck or abdominoplasty, abdominoplasty, yeah. And mini tummy tuck. Is that it?
Yeah.
Wow. So Pam, let's go straight to you. And I'm sure a lot of people are wondering right now, why go for breast enhancement?
Because I can, and I wanted to, and I was able to.
2 years ago.
Yes. And
what was the immediate response or reaction from people?
Obviously, it's noticeable. You will see change, you know, in my clothes, in my swimwear. So it's very noticeable. Yeah. And a lot of people are curious. It's new. It's newish in Kenya, I should say. But in London and America, it's something that is so common.
Now, let's mention at this point, you didn't have it done here in Kenya?
No, definitely not. And I wouldn't have.
You would not?
No way.
Why not?
Because I don't trust the surgeons here enough with my body to do such procedures, unfortunately.
There's a surgeon sitting right next to you. Let's ask him. Dr. Aidan Abdullahi. Do you get a lot of that?
Well, on the other hand, I get reverse. I get botched cases from abroad, and I fix them here in this country. Probably 2 to 3 cases a month.
Botched
from Europe and the United States.
Nose,
from breast to tummy, and you know, infections and other kind of things. But she's entitled to it. Everybody's entitled to go to anywhere in the globe to have a safe surgical procedure that they deem fit is necessary for them. So she's perfectly in order.
Yeah. Okay, let me ask you this. Is this popular in Kenya now? Because it sounds very...
Well, the word will be common. Popular will be places like in Europe and North America. It's common because, one, we've got longevity in women. Women used to have a shorter lifespan a couple of years back. But now women live long, about 80, 90, and all that. And, you know, with aging, they really want to keep their self-esteem, their confidence, their image, and all that stuff. And that's just human nature. I guess that's the genesis of how mankind has sort of developed over centuries and centuries.
Yeah, and by the way, we're looking at pictures of people like Kenny Rogers. Look at him over there. Yeah. That was Kenny before and Kenny after.
Yeah. So those are effects of non-surgical interventions like Botox injection, you know, that kind of thing, as he clearly pointed it out. But anybody who thinks that a qualified Kenyan or black African plastic surgeon is not up to the mark will be forgiven, because it's not common. It wasn't common. But you know, we do these things and we are up to it. We present our work in international conferences and we are applauded for it, and we're very proud of it. And Kenya being a hub, we get a lot of patients as medical tourism from East and Central Africa. They come to Kenya and we do it. And therefore we should really encourage this kind of work to build up our economy as well.
Yes, so on average, how many patients do you have a month?
In a month, let's put it about 20 to 25.
So almost one a day?
Essentially, yes.
Yeah, one a day.
Yeah.
And you said 25% are from the region?
25% are from the region, you know, the Comesa regions, East and Central Africa, Rwanda, Tanzania.
And what are they getting done?
Well, they come for mainly lipoabdominoplasty, tummy tucks, and breast reduction. The African population have huge mammary glands, and it's got symptoms like neck pains, backache, headache, change of posture, low self-esteem, all this stuff. And you can fix it pretty safely as long as you do your homework. You go and check whether your surgeon is a board-certified plastic surgeon.
Yeah.
If you don't do your homework, then you might fall in a trap whereby you end up messing up yourself.
Sure. Let me bring in Derek Banga at this point. Derek, why would someone want to go for Botox, say? Why would someone want to go for tummy tuck? Why?
Well, Jeff, we are hardwired as human beings to respond to attractiveness. That is something, whether you choose to believe it or not, is a fact. We are hardwired to respond. And the more attractive you are, you can even give them other traits, you know, such as trustworthiness and honesty. Now, we can have that debate. But somebody would go for that, obviously, because they want to be seen as better looking, as more attractive. And more attractive means more money. It means preference when it comes to certain things. In fact, everything is geared towards us as human beings as to being the best version of ourselves, which is the most attractive, so that we can succeed in this hyper-competitive world. So it's an evolutionary sort of thing.
So you go out of your way to enhance yourself other than what you were born with?
Now, throughout history, this has happened. Now, we're talking today about augmentation and plastic surgery, which is sort of the latest and most modern version of making us sort of being more attractive. Yeah. But whether it has been makeup throughout history, whether it has been using all sorts of concoctions and things like that, and this is just sort of the latest version of that, where, you know, whether it's women or even men indeed, will go through some of these maybe extreme procedures to make themselves be seen.
Now, you were saying earlier on in the break that that Botox, men and Botox are a very popular thing.
Yeah, so that's a very interesting anecdote. I have a colleague of mine, well, he's a friend, and he actually is a plastic surgeon, just like Dr. Terry over here, and he told me, and this is anecdotal evidence, that he has more male clients receiving Botox than female patients. So again, this is not something that is just the preserve of ladies or women, men themselves. You might not hear about it, and I don't know if Dr. Terry can back this up. Maybe they're not open with it, but men are just as vain as women. Jeff, you know that.
No.
It's open actually in UK and in America. It's very open, and they don't even feel shy about it. Sure. They don't. So it's something that is an open look. Maybe more in Africa it's more reserved because they're not sure how people will perceive them and how they'll be taken. Yeah. But in America, in the UK, it's definitely open, and even couples go together to do things together.
So we talk about it
just to add to what Derek said.
Yeah.
Derek is an image consultant. He'll agree with me. There's something called the halo effect.
Yeah, the halo effect.
The halo effect is essentially it's a fact. It's a scientific data. It's not anecdotal or imaginations. You will employ a better looking person to your shop to sell your soda than the other person. Unfortunately, that's the reality. And that halo effect that Derek has alluded to is a reality existing in the psyche of humanity.
So we're obsessed with good looks. Is that what we're saying?
That's
well,
a fact.
essentially, yeah.
You're a good-looking woman.
Thank you, Jeff.
I mean that. And the question is, did you need to go to enhance your breasts for you to look more attractive, to feel more attractive?
Well, Jeff, I'm already a confident person. I don't have problem with self-esteem. I don't have any issues like that. But I just felt like, you know, as in women, nature, you know, takes its toll, and at the end of the day, if I'm a model, there's certain things and certain criteria that I have to meet to be able to get that demands, to be able to get the payments, to be able to get the jobs, and therefore for me was a self-process. I didn't need to do it, but I preferred to do it, and I don't regret it, and I wouldn't take it back. No.
Would you want to do something else?
Yes, my bum. Yes.
What's wrong with your bum?
Nothing, but it's just not big enough, and I want it big enough.
You did not just say that. Lillian Moody, where are you?
Allegedly, I've been told that I've done my bum, but they haven't seen it yet. Right. I am about to do it.
You are?
Yes.
So what kind of a bum do you want?
Well, for me, it's not the implants. It's different, you know, procedures that you can do. For me, I take time to learn my credentials, look at the surgeon, the amount of people they do, the people that have done that in the past. I have to look at the risk factors, health-wise. It's a lot to look into. It's not something that you just wake up in the morning and say, I'm going to get my bum done or my nose job, or you have to really look into it. There's some, you can have allergies. If you go and do your breast implants or something, it will kill you. So these are factors that a lot of people are not aware of, and I think it needs to be put out there for people to realize it's not as easy as come and go. You have to really look into it and research. It took me 3 years to research before I did my breast. You know, and I just think it's something that we have to really stress to people to take it seriously. Don't look at someone and think, I'm going to do that. Also, proportion, size, tissues, you know, it's a lot of things that you have to consider. And people don't think that way. We're not informing the society enough of all this information, which is vital and mandatory.
Absolutely. I'll come to cost in a moment. Doctor, Pam mentioned something really important. And this past week, I mean, we saw this horrific story of this young lady. She went for breast enhancement or enlargement, and it was botched, or it went south, it went bad.
I wasn't in the country. I just flew in last night. So I got it through WhatsApp.
Yes.
And it's very unfortunate, and my condolences go to the family members of this soul. It's important before anybody seeks these services to check the credentials of that surgeon. Is he qualified? How many cases has he done? Is he safe? As she says, she took 3 years to investigate all this stuff. What are the side effects? You could come for a consultation and get all these facts. But it's also important you do an extra step. Get to know what are the side effects of these things. How safe is it? Where is it going to be conducted? Is it a safe institution or hospital? By and large, it's much safer to do plastic surgery than driving a car in Nairobi.
Huh?
Than driving a car in Nairobi. So it's perfectly in order. Derek, what do you think?
Derek, would you go for some Botox?
Well, let's not go there quite yet. But I don't think I'm there quite yet. But I can tell you this much. If there comes a time when I need to do something in order for me to be seen a certain way by my target market, I will make an informed decision. And that's really what it comes down to. And both of these guests have alluded to that. It's an informed decision, whether it is going and doing your research, whether it is sitting down with a therapist, whether it is doing a full scrutiny of the plastic surgeon or the doctor who is going to do that particular procedure. That is absolutely necessary. I think once those steps are taken, and you're not just doing this surgery for the sake of some, you know, Pam mentioned that she has great, you know, confidence and self-esteem, but there are a lot of people who are undergoing these sorts of procedures and they're suffering massively from low self-esteem as well as other issues and body images. And that's where I think my agreement in having this kind of procedure begins to part. If all those ducks have been lined in a row, and it's gratifying to hear that you took 3 years to make a major decision. Make that decision in concert with your loved ones.
Yes.
It is not something that should be taken lightly. And once everybody sort of is in agreement and concert, then I don't think there should be anything stopping you once you have crossed.
Clearly, again, just to add on him, you can imagine a young 18-year-old girl, genetically predisposed to 5 kilos of mammary glands here. She's a Form 2 student. She doesn't want to go to school. The parents bring her to you. You fix her, and she goes back happily, passes her exams, and her life is completely turned around. As opposed to things like, I want to commit suicide. I'm depressed. I don't want to go to school. It's not worth living my life. So we can fix this. Why not? It's knowledge.
Yeah, but you're talking the other extreme. Now, someone comes to you and says, I want my breast enlarged.
Now, for example, if Derek comes to me and says, I want to look like so-and-so, certainly he has a problem. He is a mental problem. I'd listen to him. I'd listen to him, give him time, take him to a therapist, and tell him, look, there's no problem. But if there's definitely a problem that has affected his quality of life significantly, then it's worth fixing.
Because he sees himself as Denzel Washington, say, could you make me look like Denzel? Is that
it's ridiculous. Anybody walks in and says, I want to look like Denzel Washington, you'll have to take them through a therapy, you know. But clearly if he's got an abnormality, or he thinks that, if you know that something can be done just to make sure that he's back to his normal quality of life, then so be it. And you have to assess the risk versus the safety. That's very important. You don't just do it because of the patient has come and has got loads of money to offer you. Take them through and do it very professionally.
What could have gone wrong with this young lady this past week?
As I told you, I was out of the country, but I gather that she had lipofilling. Lipofilling is fat being harvested from the tummy. You can use your own fat to augment your own breast as a female. So the fat was harvested from the tummy and was rather grafted or injected into the breast to make it firmer and bigger more or less synonymous with an implant. It's very safe, and people are doing it now, and it's perfectly in order. It's very safe, no problems, as good as breast implants. But as long as you have enough fat depots in your body, which of course many ladies do have. But it must be done by a qualified person, somebody who has had the training, somebody who has done many of these cases, and it should be done in a safe place whereby a lot of it has gone through the inspections. You know, the Kenya Medical Board, the Ministry of Health have inspected it very well and verified that it's fit to undergo surgery in this particular center. Other than that, we don't have any other problem. I've never seen any other problem with that.
Can I just ask, how long has this been certified? Because I've not heard of it. This is the first time.
What do you mean by how long has it been certified?
How long has this been going on? Like, I've not even heard of this in UK. If this has been done, I wanted to
Which is the lipofilling.
The lipofilling.
Very good. The lipofilling started about 15 years ago. Okay. It started in Miami by a doctor called Dr. Rouge, and I had an opportunity to meet him in a conference. It's revolutionized not only breast surgery, but reconstructive surgery. You could use fat to reconstruct defects of the body. If, for example, an entire muscle is missing due to a road traffic accident, you can actually fill it up with fat. And also fat has stem cells. People use fats to rejuvenate the face. You know, someone with a burns, for example, burns of the face, you can actually get the fat purified, get the stem cells, and actually inject it and make the face better because of burns and all that stuff. And that makes a big difference in someone's quality of life. So lipofilling, or using fat to augment your own breast, has been there for almost 15 to 20 years, and it has taken a whole lot and is actually displacing implant-based surgery every year.
Derek, one of the topics I learned in Psychology 101 is something called narcissism, love of self. Is that what it is in this case? Is that what we've become? Our conservative African society has now turned on its head.
Jeff, I certainly in this case, I don't think that it is narcissism. I believe that every human being has the right, as somebody who is born on this earth, to be the best version of themselves. They have the right to all of the things that, you know, sort of are endowed upon us as human beings, and including the right to be able to stand up in public and to be able to present whatever it is that they think best represents them to the world. I don't think that's narcissism. I do believe narcissism exists, but in the case of a lot of these procedures, I think we're looking at, for example, somebody is born with, or they get, you know, scars as a young child, and that person then goes and gets reconstructive surgery or plastic surgery. I wouldn't call that narcissism at all. There may be a thin line in terms of certain people getting parts of their body augmented for certain reasons, but I think those have more to do with psychological issues and not necessarily have to do with narcissism.
Yeah.
Yes.
Pam, would you recommend this to your girlfriend?
What, the boob job?
Yeah, boob job, bump job.
It depends. The one he's talking about, I am not so sure about, because I haven't had enough of it and I haven't researched into it, so I would not advise something that I'm not sure of.
Okay, so what you did with yourself? Yes,
I would recommend it, but again, I say it strongly and I stand to be corrected. If you're going to do something like this, a lot of research needs to be entailed, and you need to know your body size. Someone can come and say, I want to have a double D, and their breast tissue and breast size and their body size does not fit. So if you insist and the surgeon does it for you because that's what you want, it's obviously going to go wrong. Eventually it's going to get botched, because you're not listening to your surgeon, you're not listening to your body.
Yeah, she's very right. I get a lot of these ladies who come and tell me, I want this particular size, and I tell them, no, your body frame does not fit this. And you know, eventually I always win, and they appreciate it.
Yeah, it's like putting a Ferrari engine in a Toyota.
Yes, it doesn't make sense.
That's a nice analogy.
Like that.
I love that too. You know, it's funny because the pressure in the community and in this world, right, is so high that people look up to a lot of artists, a lot of celebrities, and they want to be that person. So I think us as celebrities, we need to stand forward and explain to them and let them know in the society that it's not just done like that. First of all, you don't just think that I'm going to do this, I want to be like that. You can never, two people can never be the same. You can never be the same. So I think you need to do your own researches, make sure your surgeon has the right credential. And another thing as well, money comes into it. If you can't afford it, please do not even think about it, because there's no point of you going to buy let's say Gucci in Kakamega, you're gonna get Gucci. Jeff, you will get Gucci, and you're not going to come back thinking that this is Gucci because you will be fooled. You're fooling yourself.
You'll get Nokia.
I'm sorry, I will say it again. It is not like that, Jeff. They need to understand. If you want to do something like this, it's a big procedure, and it takes a lot of money, and it takes a lot of time, self-esteem. It takes a lot of confidence. It takes a lot of discipline, because after even the procedures, the surgeon is not there for you. You have to follow and be disciplined in your medication, in your treatment. It takes a lot.
Is it expensive?
Oh, very expensive. Very expensive. And if you don't have that money, don't think about it.
Give us a ballpark.
Pounds, thousands in Kenya.
Give me some pounds.
Over 10.
1,000 pounds.
Yeah.
Dr. Ari, what do you charge for?
We'll do it for 5,000 pounds.
You did have the price.
Look, Rajef, I can't charge 10,000. The economics of the UK
I will correct
is
you.
certainly different from here.
I will interfere over there if you allow me.
Sure, please.
If I'm going to do it with him in Kenya, obviously I will pay 5 because I'm not paying for a flight from London to America. I'm not paying for accommodation and nurses to take care of me. So hence why the prices increases. So again, it varies where you do it. It varies which surgeon you're taking. It varies the medication. If you have to pay for it, all of these things take until. So I might pay 5,000, 3,000. Someone might pay 2,000. But at the end of the day, it just matters where you get it done and who does it.
Yeah.
So you're charging 5,000.
The economy. You see, if you live in London, in the suburbs of London, and you go to Harley Street where these things are done, you'll probably pay 15,000 quids, 15,000 pounds. That's the cost of breast augmentation in a very reputable center.
Which is about what, 2 million shillings?
I mean,
more so if you go to America.
If you charge that amount here, I'll probably do 1 or 2 cases a month. So I've got to go down, look at our economics, try to see and help as many patients as possible.
And do 30 a month.
And do about as many as possible. I'll probably go half of that.
Wow.
And the other thing I would like to pass across as a message, if you go to the internet, you'll find loads and loads of offers. You have to be very careful. She did her research. She went to find out the credentials of the surgeon who's going to operate her, the center, the complication rates, all that stuff. If you just go because there's some lady there with a microphone who wants to chat with you and then you get hooked up, you go and then you get botched, you come back and then Adam fixes the dirty job of another surgeon, it's a big problem. So what she did is actually the ideal way. Investigate who's going to do your work.
Jeff, I call this selfie surgery. Selfie surgery.
Nice.
We want to take the perfect selfie.
Yes.
This is a society that's become obsessed with looking a certain way. Everybody needs to sort of look in themselves first of all and see the good that you have. I'm a Christian. I believe we're all wonderfully and fearfully created. However, we also want to give the best version of ourselves to the outside world, which is why you dress in an immaculate 3-piece suit, because that is what the image that you'd like the world to see yourself. Now, if you have something that is drastically wrong with yourself and that is hurting your self-image, and you have done your research and you've done the therapy and all the things that our guests have talked about, then who am I to stand in the way of you living a fulfilling life? But it starts on the inside first. And this shouldn't be the first choice, especially for young girls or young women.
Guys, let's take a quick break, come back, and I'm going to ask you the question about addiction. Is there a fear of addiction, getting addicted? A lot of people who have gone through Botox or do Botox go back and go back and go back until they can't even smile anymore. Or if they smile, you can't even see them,
Yeah, I think Botox wears off. I think it has to be done again.
Yeah, exactly.
Yeah, precisely.
And sometimes you find someone smiling and half their mouth is crooked. Well, that's another story. Yeah. Wow, this is a great topic. This is amazing, incredible. Thank you. Pam Gallimore, reality TV host, model and interior designer. Dr. Aiden Abdullahi, 2 clinics, Landmark Plaza, Karen Hospital. I'm sure you're very busy.
Well, kind of.
And Mr. Image Consultant himself, Derek Banga. We're talking about extreme beauty, plastic surgery. My goodness, this is a reality. It's every day now. Let's take a quick break, come back, and we'll get some more insights. You're watching Citizen TV. By the way, if you want to tweet us at Koinange Jeff, at Citizen TV Kenya. Let's use the hashtag Citizen Weekend. Let's get your comments, questions, and what you guys think. of extreme beauty. Take a break. Back in a moment.